I think we should get going. Hello and welcome to this Institute for Jewish Policy Research event. I'm Jonathan Boyd, I'm the Executive Director of JPR and I'm going to be hosting the event today. We're really delighted that so many people have chosen to join us from all over the world, from Israel, the United States, Canada, Australia in the middle of the night, I think, and all over Europe, here in the UK, as well as France, Germany, Italy, Spain, Poland, Hungary, Austria, Switzerland, Ireland, the Netherlands, and probably other countries that I've forgotten, all of which is very fitting because our discussion today is very much an international one, looking comparatively for the first time at how different Jewish communities around the world have been affected by COVID-19. But before we start, let me say a word or two about JPR. JPR is an independent research institute based in the UK that specialises in studying Jewish populations and issues of concern to them in the UK, across Europe, and indeed around the world. Our work is very much policy oriented. We generate data specifically to support community life, and we touch on multiple topics, including demography, education, identity, social care and welfare, health, economics, anti-Semitism and Israel diaspora relations, among many others. Of course, our topic today very much focuses on health. Indeed, when the pandemic began in earnest 9 months ago now, JPR rapidly adjusted its programme and turned much of its resource to trying to understand how COVID-19 was affecting Jewish life and indeed Jewish lives. We knew that COVID-19 could be a game changer for Jews as for everyone. So it was an imperative for us to produce reliable data that could allow us to assess what was going on and to share it with community leaders, researchers, doctors, and epidemiologists. Now, part of that work has been focused on the UK community specifically. We ran what turned out to be the largest study of British Jews ever conducted to look at the pandemic's impact on Jewish people's health, finances, jobs, social relationships, and Jewish community lives. And we've already published several reports from that survey. They're all available for free download on the JPR website. That's jpr.org.uk. They include studies looking at the pandemic's impact on mental health and economic disadvantage. And there are actually 2 more reports in the pipeline, which will be published in the next few weeks, looking at its impact on community income and people's jobs. We'll be running more events about that work in the new year. And also next year, using our new UK Jewish Population Research Panel, we're going to be running a follow-up survey to take the community temperature once again. Now, at the same time as all of that, we've also been painstakingly gathering mortality data from all over Europe and the wider world to try to determine if Jews have been affected disproportionately, and if so, why. JPR holds a strong European brief. Indeed, the study we're talking about today was conducted by our European Jewish Demography Unit. It's a new unit within JPR established at the beginning of 2019 to generate up-to-date demographic data about Jewish populations all over Europe to support community planning there. The unit was established thanks to a generous 3-year funding commitment from the Rothschild Foundation Hanadiv Europe, and it's busily producing country-specific reports, demographic issue reports, and up-to-date Jewish population counts for every country in Europe based on the best available sources. And I'm really delighted to welcome Sally Berkovich, Daniela Grieber, and Nicola Kobold from Rothschild here today, and to thank them publicly for their support. They do extraordinary work investing in valuable initiatives all over the continent, and it's a genuine privilege to work with them. Let me briefly explain the format of today's event. In a moment, I'm going to hand over to my colleague, Dr. Daniel Stetsky, who is the director of the JPR European Jewish Demography Unit. Daniel is a senior research fellow at JPR, having previously worked as a senior analyst at RAND and Israel's Central Bureau of Statistics. He holds a PhD in social statistics and is the primary author of this new report on mortality. Daniel will present the report's findings and explain why we did what we did. After Daniel, we're going to hear from the world's leading Jewish demographer, Professor Sergio Della Pergola. Sergio is Professor Emeritus and former chairman of the Hebrew University's Avraham Harman Institute of Contemporary Jewry and the chairman of JPR's European Jewish Demography Unit. We at JPR are so thrilled that he's chosen to join our team. He brings decades of experience with him, built on the knowledge gained from publishing over 300 papers on Jewish demography, and he regularly advises the Israeli government and Jewish communities around the world on demographic trends. Also joining us on the panel is the other co-author of the reports, the demographer and adjunct lecturer at the Braun School of Health and Community Medicine at the Hebrew University, Ari Paltiel, whose expertise lies in socio-demographic research and mortality statistics, and who over the course of his long and distinguished career has held several senior positions at Israel's Central Bureau of Statistics. As for me, today, for a change, I get to sit back and allow Daniel and Sergio to do the real work presenting our findings. But I'm going to be fielding questions after we've heard from Daniel and Sergio. So if you want to ask a question, you're free at any time during the event to use the Q&A function at the bottom of your screen. Just type in what you want to ask and I will process the questions and put them to our speakers this evening. Our time is limited. We only have an hour in total, but I'll do my best to cover as many of your questions as possible. So without further ado, let me hand over to my colleague and reports co-author, Dr. Daniel Stetsky.
Good evening, good afternoon, good morning, good time of the day, I should say. Without further ado, I will start my presentation. I will share some slides with you when I'm allowed to do so. Okay, so for as long as I can run without the slides, I will try to do so. I will share with you, I will begin the presentation by sharing the motivation for this research. Very early in the course of this pandemic, the first journalistic reports appeared, both in the Jewish press and in the non-Jewish press, and they suggested that Jews may be more affected by coronavirus than others. That happened as early as March, so the very beginning of the pandemic. Some of these reports had, I would call it a catastrophic tone. I will give you a few quotations from the article published by the Jewish Telegraphic Agency on the 5th of May, and that means something. An article that was published on the 5th of May would have been put together sometime in April. And if it was, and that also means that it would have related to the realities on the ground somewhere in the beginning or perhaps in the middle of April. So at the peak of the pandemic. And the article said the three following things. In many large Jewish communities worldwide, the coronavirus is wreaking a terrible toll. That's message number one. Message number two is the death toll is in the thousands and climbing. And message number three, it's impossible to say how many Jews died from COVID-19 because governments do not count deaths of their Jewish citizens separately. So there is a little bit of a contradiction between the death toll is in the thousands and climbing, and it's impossible to say how many Jews died. These things cannot be true both at the same time. But those of us who are regularly kept on journalistic diet, perhaps are not surprised by these contradictions. What it says basically, that we don't know what the situation is. We have suspicions, but we don't know what the reality is. And we decided to change it. We shouldn't allow journalism to shape policies, but we certainly should use journalism to inform our research efforts. It tells us where to look, what to do, and we should shape research designs accordingly. So in our own research, we asked three questions led by the Jewish Telegraphic Agency and others. Can we actually tell how many Jews died from coronavirus? Is that possible? And then also, are Jews affected by coronavirus more than others, like some early reports seem to suggest? How do Jewish communities differ from one another? These are the questions that we asked. And now I'm going to tell you how exactly we did it. How we did it. We requested data on deaths from Jewish burial societies across the world, across the diaspora, all those Jewish burial societies that we could identify. We also requested data from the Statistical Authority of Israel. It was easier for us to gain data from some communities compared to others. And the key variable, the key factor that determined the degree of difficulty or is, was the dispersion of Jews across country. Our easiest case, of course, was Israel, because Israel has an established statistical authority that collects data on deaths by religion. And so we could request deaths of Jews from Israel, from the Israeli Statistical Authority. This wasn't a problem. In other places, it was burial societies in different parts. Some of the different parts of a country. In some countries, we have super concentration of Jews in particular places, typically in large cities and capitals. For example, in countries such as Hungary and Austria, almost all Jews live in one place, and it's a capital city. In other countries, they're not as concentrated as that, but they're rather concentrated enough to make it simple for us. For example, in Paris, in France, and in United Kingdom, 60 to 70% of Jews live around the capital city. The most difficult cases were countries with great dispersion of Jews across the country, and a master example of that kind of situation is Germany. German Jews are dispersed very widely. They're scattered everywhere in every single corner of the country. And that wasn't easy for us, but we had, early on, we had strong cooperation of the central welfare body of German Jews, who basically on our behalf approached different burial societies, who then subsequently made their data to us, available to us. In each community, we asked for something extremely simple, which was the number of deaths per month for the time of the pandemic, and slightly before, slightly after, but mainly January to May 2020. We also asked these burial societies to give us monthly deaths for the time before the pandemic, year 2016-19. And that we needed to do that in order to estimate the benchmark. So we treat the past years, the history of each burial society and its deaths as a benchmark, years 2016 and 2019. We relate to past years as an indicator of how many deaths are expected under normal circumstances. We all know that deaths and births they are the normal features of life. The deaths occur all the time. Not just during the pandemic. During the pandemic, we have more deaths than we can expect. If the number of deaths in 2020, i.e. during the pandemic time, is higher than the average across 2016-19, these extra deaths can be rather unambiguously attributed to coronavirus pandemic. We call it the excess mortality method. And it's a method that established itself very early on in the course of the epidemic. Various groups of scholars, of epidemiologists across the world adopted this method pretty early in the course of the pandemic. The data for non-Jews are available from the national and European statistical agencies. We wanted to carry out systematic comparison of each Jewish community everywhere to non-Jewish community, and so we approached those agencies. In England, it was the Office for National Statistics. There's a similar agency in Germany, France. We also approached Eurostat for that data. Now, you may have been asking yourself now, why to use such strange, maybe indirect method? Isn't it more simple to simply somehow ask the communities how many deaths they had from COVID-19 instead of estimating extra deaths indirectly? And it is a seemingly simple method. And indeed, the number of infections, number of deaths from COVID-19 is also something that started circulating in the press and even on social media pretty early on. So now we decided not to go via this route. And this is for two reasons. First, COVID-19 is the new cause of death. And secondly, perhaps more importantly, it's a cause that works in tandem with other causes. It is very well known that COVID-19 is particularly fierce, particularly dangerous for people who are in the older age groups. People in the older age groups typically have more than one, or often, maybe not typically, but often have more than one condition already. And COVID-19 is just one of the conditions that they may have. Doctors who treat those people may or may not be aware of all conditions, may or may not be aware of COVID, may or may not use that diagnosis on their certificate. Let us also remember that it's a new reality. It's a quickly changing reality. The official recommendations from the World Health Organization were published somewhere in April. So effectively, when the epidemic was around its peak, the first wave of the pandemic. The result of all that is that, particularly within the context of international comparisons, we are running a danger of inconsistent comparisons. If the different countries, the different systems have different ways of capturing COVID-19, we will not be necessarily making consistent comparisons. And so we decided early on not to rely on COVID-19 diagnosis as such, but on excess deaths instead. Here I'm showing you a table. There's no need to look at every single number there. It's just an example of what we sent to the communities. Only when we contacted the burial societies in these communities, this table was empty. We sent this table years 2016 to 2020, months January to December, and we asked the communities to populate this table, to put in each single cell the number of deaths, all deaths, not deaths from COVID, but all deaths that their communities experienced in that month. That's how it looked. And now I'm going to show you what we actually did with this data. Next slide, please. Here, I'm going to take you through this table, column by column. What are the communities that we highlight here are three largest Jewish communities in Europe: France, United Kingdom, and Germany. On the left-hand side, in the first column, you can see that these three countries are, I use different colors for them. There's a color scheme there. Germany is colored in blue, United Kingdom in red, and France in sort of orange. That signals you early on the strength of the COVID pandemic in these three countries. And I will tell you now, using the example of Germany, how we performed calculations and how we obtained the conclusion whether or not there was excess mortality in this particular country among Jews, among non-Jews, and how these communities compared. So focusing on Germany now, the expected deaths in those German lands that from which we received the data in that particular season, in March to May 2020, the expected deaths should be 118. The actual observed deaths that happened were it was a slightly lower number, it was 114. The ratio of these two numbers is very close to 1. That's the ratio for Jews, and that indicates very clearly that there is no sign of the pandemic there. 118 deaths were expected, very similar number was observed, or even smaller, negligibly smaller. There's no sign of the pandemic. This same situation exactly prevails among non-Jews. The ratio there is also 1. Our conclusion regarding the impact of COVID, that the impact of COVID is low, and we see no Jewish penalty, i.e. Jews are not affected by COVID more than non-Jews. Now I'm going with you to the other pole of this situation, which is a Jewish community in the United Kingdom. In 3 locations, we have data for 3 locations, for London, Manchester, and also for Scotland separately. In each single case, you can see that the observed deaths are much, much higher than the expected deaths. In the case of London, the observed deaths are over 600. The expected deaths are about 300. So the ratio of observed to expected is about 2. The mortality in this particular season is 2 times higher what it is expected. Among non-Jews, there is also elevation of mortality, but it's not nearly as significant as among Jews. It's between 1.5 to 1.7. We then diagnose this impact of COVID as high, and we can see here clear Jewish penalty. The Jews affected by COVID-19 more than non-Jews. Finally, we come to France. Both places that gave us data. Paris, it's a very large proportion of Jewish community of France, and Strasbourg. Both places are evidently affected by COVID, significantly so, but nowhere near Britain, and not as low as Germany. We conclude that the impact of COVID in this particular place is medium, and there is some evidence of Jewish penalty as well. Here, basically, this is an enhanced presentation. What you see in front of you is just the ratios. There's no number of deaths anymore. There's just ratios of number of deaths. In March to May 2020 to the average number of deaths in normal season before the pandemic. This is for Europe. I use these labels, British pattern, French pattern, and German pattern, to basically correspond to describe the patterns of significant excess as a result of COVID, moderate excess, which is a French pattern, and almost no excess, a low excess, which is German pattern. What you can see on the left-hand side, so in all cases, Jewish ratios appear in blue, non-Jewish ratios for comparison appear in orange. In Britain and London, Manchester, and Scotland, you already see the Jewish ratios are between 2 and 2.7, so the mortality effectively, there's excess mortality, which is 2 times higher of what it is expected. The same pattern we see in the Jewish community of Stockholm in Sweden, and also in Jewish community of Milan in Italy, and also in Jewish community of Brussels in Belgium. Going to the other pole, the German pattern, what we call the German pattern, obviously, it's also observed in Germany. The ratio is close to 1, which means no excess. We can also see that a similar pattern is also observed in Italy, in Jewish community of Rome. So there's a very strong contrast between that community and Milan. We also find it in Jewish community of Austria, in Vienna. And finally, the French pattern, the intermediate pattern, obviously it's observed in France, as you will already know. And what also other places that fit into this pattern are the Jewish community of Netherlands, particularly Amsterdam, a Belgian community populated of Antwerp, the city of Antwerp, which is predominantly strictly Orthodox, and the community of Budapest in Hungary. John, please, next one. Here I'm taking you outside of Europe and I'm presenting now all the communities from outside Europe that contributed their data to us. The highest excess in deaths we find in the Jewish community of New York in the United States of America. You will see that the ratio is about 1.8, and it's an interesting one. It's almost as high as in the worst affected communities of Europe, i.e. Britain and Brussels, but not as high, almost. The New York Jewish community is also unique in the sense that although the excess, the impact of COVID is very high, it's not as high as in the rest of the population of New York. Florida is in a completely different place. You can see there's a very slight excess, or I would say moderate excess in Florida. And the same situation is also observed in Canada, both in Toronto and Montreal. So we can say that whilst New York fits into the British pattern, Florida, Toronto, and Montreal fit more into the French pattern. While Israel and Australia at the very bottom, they fit into the German pattern. In these communities, we see no impact of coronavirus on excess mortality. To be sure, of course, there are some deaths there from coronavirus, but they have not changed fundamentally the picture of mortality in that season. And now the next, please. And finally, this is your dessert. Here is the wave 1 impact on all Jewish communities that we have data from. Some of the communities I have shown you already. Some of them I haven't, simply because the numbers I received from them were so low. These are small Jewish communities. I simply could not calculate stable, reliable ratios. But I think they're worth mentioning. If there is one word which I asked to use to describe the state of the pandemic, at the stage of wave 1 at least, in the Jewish world globally, that word would be perhaps a mosaic or a spectrum. Okay, that's a one-word description. We have many highly affected communities in England, Scotland, Brussels, in Sweden. The high impact of COVID is observed both in Stockholm and Göteborg there, in Milan, in New York, and also in Moscow in Russia. On the other hand, we have a very significant selection of places which appear to be unaffected, at least at wave 1, which is Germany, Austria, Israel, some places in the south of Sweden, in Malmö, Denmark, Finland, Australia, and Italian capital, Rome. And there are places in the middle between these two poles. And the next one. So can we actually tell how many Jews died from coronavirus? Well, yes. By comparing the number of deaths during the pandemic to the expected number. It's a very simple method, very friendly, doesn't depend on COVID diagnosis and all the discussions around that. And we've done so. We found that as a whole, if we're talking about Jews globally, they're not affected by coronavirus more than others. In certain places, they are. In England, in Scotland, in Brussels, in New York, these, so not in New York, in England, in Scotland, and Brussels, these are the most affected places. And this is probably the chief lesson from wave 1. However, we find a mosaic of situations, a wide spectrum of situations. While some Jewish communities are very badly affected, there are other communities that seem to have had minimal impact of COVID, such as Germany, for example. And now the note of thanks. From the bottom of my heart, really, I thank everybody who helped us from the Jewish burial societies across the world. We had an extraordinary level of cooperation. They shared data with us generously, and for many of them, it was a significant imposition. Sharing data is not what Jewish burial societies are about. That's not their primary role. And it would be impossible without them to understand the global situation of Jews with respect to coronavirus. We also thank the Rothschild Foundation and Adiv Europe for their generous support of the European Jewish Demography Unit. Our next steps is the wave 2 of the pandemic, of course, documenting that. We are now in contact with various Jewish burial societies across the world. So I should say, perhaps stay with us. You are very likely to hear more from us about Jews and coronavirus. And I would like to finish on a note, on an optimistic note. Some of you may have heard that the Chancellor of the Exchequer in Great Britain, Rishi Sunak, said two quite uplifting things recently. One thing is that, according to his information, Britain is very likely to undergo a very rapid recovery when pandemic is over. And that's obviously a clear note of optimism. But there's another thing that he said, and he recommended that the British people, when pandemic is over, go on a spending spree. So to stream into the economy all that money that was not spent during the pandemic because people didn't have holidays, because they commuted less, etc., etc. So the economy can restart quicker. I would like to strengthen that particular second part, and I could tell you that you can help the British economy via JPR. If you go to our website, you can obviously download all of our publications. You will also find there a donate button, and that button would help you to go on a spending spree even before the pandemic is over. So use that donate button to support our work and help Britain in the pandemic. Thank you very much. It was a pleasure having you.
Thank you, Daniel. Thank you for that fundraising pitch as well. That's great. So what we've covered just some of the data, obviously, from the first wave of the pandemic, just looking specifically at the sort of the March to May period. And as Daniel said, we will continue to gather this data so we can see what's happened subsequently I imagine the dynamics in some of the countries that we identified as unaffected or less affected may well be different when we look at future waves. But based on what we can see from the first wave, you've seen the results so far. I want to hand over to Professor Sergio Della Pergola, who is the chair of the JPR European Jewish Demography Unit, just for some responses and any additional comments, Sergio, that you'd want to make on the back of Daniel's opening remarks. Sergio.
Thank you very much, John, and thank you, Daniel, and good evening to all. In fact, my first reaction is that the timing of this meeting is particularly tricky. On the one hand, with dramatic effort of scientific cooperation internationally and internationally, we have seen several research institutes and commercial companies in developing a vaccine or different solutions or thought of solutions to the pandemics. And so this is a reason for optimism. We have seen high-profile people being inoculated, private and public figures. And this would be, in fact, the beginning of the end of the danger and a note of optimism for the nation and for humankind. But on the other hand, we also learn from the press, from the communication system, that there seems to be going on a transformation, a mutation in the virus, which makes it more aggressive, more dangerous. And therefore, it is not entirely clear whether the solutions that have been found will really help. And maybe yes, hopefully, but maybe no, there will have to be new solutions to the problem. In other words, the problem is with us. And I think a note of caution is in place given these quite contradictory circumstances. And I think it is therefore, first of all, particularly important that the JPR, its researchers, and all of those who collaborated with us have been able to put together this report, which is really a kind of very impressive breakthrough in terms of academic interest and also for the applied value that it has for Jewish community. Allow me just to say, just to underline the paradox of the contradiction. One person, the general secretary of the Jewish community of Rome, Dr. Emanuele Di Porto, who was instrumental in providing us with the data about the Jewish community of Rome, which is the largest in Italy, was hospitalized a couple of weeks ago under very serious conditions because of COVID. And only a few days ago, he has re-emerged from real danger, and he has sent a smiling message to his friends and family. So you see how different it may be. Daniel Stetsky was just mentioning Rome as one case of the mild development of the pandemics. And here we have a situation which is quite different. The second wave might in fact be quite different from the first. And since now and already by now, it is quite obvious that we must plan follow up a new report and seeing whether the second wave developed differently from the first one. But there are a number of general considerations that emerge from this study. One, which in my view is extremely important, is the different spread and incidence of the virus among different Jewish communities. Because you see, there is also a question which is partly demographic, partly also philosophical, in terms of the compactness and the equality or uniformity of the Jewish population worldwide. The big question of, if you wish, race and inheritance or biology versus culture and environment reemerges here. And here that we have quite a striking example that Jews under different circumstances have rather reacted. They have been affected rather more by what has happened around them than by what has happened to Jews in other places. I think this is an interesting message scientifically, also from perhaps a public point of view, when you consider that unfortunately, as one of the side effects of the pandemic, we have expressions of anti-Semitism and even aggressions against Jewish community. So it is not so. Jews are very much like the others, at least under the circumstances that we are studying now. Another consideration, though, which is quite serious and may prolong the effect of the epidemics in the longer term, is the sequence between health problems, economic problems enhanced by the huge increase in unemployment, and then political problems. We have certainly observed in many countries a kind of disenchantment of the population vis-a-vis the authorities. In many cases, the authorities did their best to control, to combat, and to win the problem. But for sure, there is a sense that government is not always adequate, and this may have disastrous consequences for democracy, at least in some countries. So you see how complicated the situation is. And one further point, which I have expressed in the preface of our report, is that I feel that there has been quite a significant failure in trying to measure the incidence of the COVID, because there are so many dimensions and so many differences within even the population of one country or one region or even one town, based on the stratification by social class, by religion, by the veteran or junior status of immigrants in those countries. And all of this requires a much more complex matrix to understand the incidence and the diffusion and dispersal and spread of the virus than I think has been done. It is true, though, that the UK have been on the forefront of this effort to understand better the situation. The Office for National Statistics has produced two fundamentally innovative and very interesting reports on the incidence of COVID across different ethnic and religious groups in the UK. I think it's quite unique internationally. And then JPR, also thanks to its survey capability, has been able to deepen more the view of the consequences for the economic, social, psychological, and relational networks of those affected. So there is quite a lot that has been done in the UK particularly, and that might be imitated in, I think, in other countries. Finally, my last consideration is that the experience of this work shows how important is the constant effort of data collection, both by the general institutions that deal with that, but specifically by the Jewish communities. I think, as we have seen clearly demonstrated by Dr. Stetsky, that some countries have been able to provide us detailed and quite accurate data on the fluctuations of mortality over time, whereas in other countries and in some very large communities globally, this has not been possible. I think one of the lessons we bring home is that having an infrastructure of regular data collection of demographic data on death, but also maybe on other events like birth and marriages, and at the same time being able to develop a survey capability by the Jewish communities would be essential to be readier to face occurrences of this type and maybe of other types that unfortunately may happen periodically, so that the Jewish community can be prepared and can develop the internal policies apt to reduce the negative impact of the phenomenon, and also contribute to the general community its insight, its data, and its participation in a social society, a civil society that has to be compact and united in front of these very special circumstances that unfortunately, I conclude saying, are still with us and will be with us for the months to come.
Thank you, Sergio. That's very for some very insightful comments. We've got a lot of questions coming in and limited time, so I'm going to let me start with one that's come in from Professor Steve Miller, which is really a methodological question to begin with, and I will try and keep this relatively short because I think there are more sort of substantive issues to explore. But he's questioning the excess deaths method. Saying that, you know, it has its weaknesses, not least because many deaths don't happen under the conditions of a pandemic because of, you know, fewer road accidents or or many other reasons actually. So how do we know that the excess deaths method is better, or is the best way to measure this? Daniel or Ari, maybe this one's probably for one of you.
Ari, would you like to go for it?
Well, let's try to say something about, is it the best method? No, it's not the best method. The best method is if we were able to take both cause of death data and perhaps clinical data from hospitals and data from comparing to previous years, put them all together and come to some conclusions. Maybe that will be possible in the future. It's certainly not possible now. What the advantage of the excess death methodology is that you can use it very rapidly. And you can't take account of everything that you've mentioned, not the fact the dearth of deaths from certain causes, but you can see whether a pandemic has caused a surge in mortality. What you're doing is creating an aggregate figure. You can't count the number of people in that excess. They're not individuals. They're a difference between two numbers. And so we don't know anything except that we have an excess in that period. But that excess tells us a great deal. It tells us that things have changed from what they used to be, and they are different. Now, I'm going to jump over to another question that was asked that's related to this. That excess mortality, do we take account of the age structure, differences in age structure between different communities? Well, we don't do so directly, but because we're looking at excess mortality, the age structure last year and the previous year was very similar to the age structure this year. And so therefore, when we're comparing when we're calculating the excess mortality, in fact, we're neutralizing the differences in age structure. Where is this still a problem? When we want to compare two populations, when we compare excess mortality among the Jews with excess mortality among the non-Jews, there the differences in age structure might affect the proportion of excess mortality in that particular country. So that has to be taken into account. But remember what we were trying to do. We were trying to, in the midst of this pandemic, reach some conclusions with the data that was available, that was collected with a great deal of effort. And I think this is extraordinary. 2020 is not yet over, and already we have mortality data that we can use to analyze whether Jewish communities are similar, different, whether they're like the communities surrounding them or they're not.
Can I just step in on the age question? I take what you're saying, Ari, but we've had a number of questions about it, and I think our initial contention at JPR was that there may be an age factor here, because we know that older people were more susceptible, and that might have accounted for the high death toll in the UK anyway, which is where kind of the issue where we were focused on the issue at that time. There was this report that came out that Sergio, that you mentioned in the UK from the Office for National Statistics that looked at this issue. Can you just, either Sergio or Daniel, can one of you summarize what it said and why, and what was significant about it?
Well, what was significant I will just take one observation in the comparative context of the UK, which of course has quite a different population. It came out that the Jewish community, the Jewish population, had some of the highest ratios of mortality when compared with other groups. In fact, if I am not mistaken, only the African British group had a higher incidence, whereas other groups, which perhaps were more comparable on a variety of characteristics, had lower incidence than the Jews. This, of course, brings us to the question of the chain of transmission, whether it is biological or it is also socially determined. The question which has been very much debated in Israel, but also in the US and in the UK, about patterns of behavior. One thing is simple discipline, but the other thing, which is perhaps more characteristics, is big gatherings of people on the occasion of social meetings that have maybe a religious contents or a social contents, big marriage ceremonies or big prayer reunions. This is a factor that has been discussed very much in the Israeli context, and may perhaps provide at least a partial lead also to what has happened in the New York area, maybe in Manchester and elsewhere. However, I also want to say that in some cases, although we know that the age composition of the Jews is more aged, is older on average than among the total population of that same area. Nevertheless, we found that sometimes the indicators are quite similar for Jews and non-Jews. That is, there is something which overarches, something more regional, that is even stronger than the age differential. The age differential is quite decisive, of course, in this case. And this leads us to also asking questions about the medical system, about the diagnostics, about the hospital capabilities. And these are quite differently spread across the world and even within countries. And this is another factor that certainly had an incidence.
Thank you. There's another question that's come in. I mean, there are actually a few questions that came in about this, the social dynamics, and specifically, I guess, about the impact of Purim, which was on March the 10th, as well as weddings and B'nai Mitzvah and those sorts of communal events. There's also a question that's come in from Dr. Colin Lecce, I hope I pronounced that correctly, about whether we've seen any distinctions by denomination or type of Jew, and specifically there was this strong contention, that's been going around that high levels of non-compliance, particularly in the Haredi community, may have driven higher levels of mortality within that group. What do we know about that? Daniel, do you want to comment?
Yes. So most of I will describe the data that we have on the denominational aspect. In the case of Britain, there's a very big community, well, second biggest community in Europe, and we received data from various denominations, and we could effectively calculate excess mortality, not quite by denomination, but I would say broadly by degree of religiosity, with one exception. We didn't have data for the strictly Orthodox community in sufficient numbers to arrive to firm conclusions. So omitting that particular bit, and I will come back to that, my observation so far is that there's a very, very moderate gradient. We could see a very significant excess mortality among what's called liberal community, Jewish liberal community, as well as the Federation of Synagogues, which is, the Federation is I would say, the more religious part of the spectrum before strictly Orthodox. So, as well as in the middle, which is United Synagogue in Britain, which is a mainstream Orthodox. So there's a very, very moderate gradient. We don't see within that realm, when we look at these groups, there's no connection between the level of religiosity and the degree of excess mortality. Now, what is known to us about the strictly Orthodox today comes mainly from the Jewish community of Antwerp. It's a very, it's completely clear that that particular community, the excess mortality in this particular community is lower than it is in Brussels, which is a non-strictly Orthodox community. So we are looking forward to receiving more data, and hopefully in the future we'll be able to comment on that as well. But so far, these are our findings. I would like to emphasize, my main message here would be this. Whilst we don't have sufficient data at this particular moment in time, and this may change in the future, to talk about strictly Orthodox mortality, we do have sufficient data to speak about non-strictly Orthodox mortality. And all those cases of very significant excess mortality in Britain, both in England and in Scotland, and in Brussels, and in Sweden, these are cases where all that is happening in non-strictly Orthodox communities. When we have data from strictly Orthodox communities, we will comment on that, but that particular finding comes from non-strictly Orthodox communities. And that would be the end of my response for now.
Sergio, Ari, anything to add from the Israeli perspective?
If you're referring to the differences between Haredim and non-Haredim in Israel, well, it's clear that in the Haredi community there was the excess mortality is much more prominent than it is in the rest of the country. But again, we're in the midst of this pandemic, and I wouldn't want to comment yet on how things will look when we've looked at the data in greater detail.
I would like to expand a little bit the question, because mortality, unfortunately, is the last step. But there are some previous steps which are also interesting. How many people were infected, and how many people recovered, and how many people were hospitalized and were in intensive care, and then out of these, how many died? That is, there are several stages which are also interesting to assess the dynamics and maybe the causality of this phenomenon. And here I must say that my opinion is that this has not been measured and assessed sufficiently, although it wouldn't be so complicated. There are several countries that have statistical systems that allow for those types of analysis. Often we speak of the infection rate, but it is based on measurement which is not totally systematic, not random. We don't have a sample of the total population. We have a sample of those who decided to go to a doctor or to an infirmary and be tested. And this is highly subjective. It is reflecting all sorts of economic and psychological and personal considerations. And so I'm sorry to say, in spite of all, we have the capabilities, but the quality of the measurement that was displayed, in my view, was very poor. And so it obscures some fundamental aspects of the issue. And I hope much better will be done in the future.
Thank you, Sergio. So just one, we've got time for one last question. It's a question that came in from Harvey Bratt, and I'm just going to take part of your question, Harvey, if that's okay. But that's it's about whether there may be any sort of underlying genetic cause that's affecting Jews in some way. And my assumption is when you see different communities affected in such different ways across the world, that presumably gives the lie to that contention. Any reflections, any of you?
I would agree that, and I think I also said that the diversity of incidents and responses across Jewish communities worldwide, some of which have many commonalities. Let's not forget that the Jewish people is composed of immigrants and children of immigrants and grandchildren of immigrants who came from different parts of the world. There is an important Eastern European component, but there are Mediterranean components. And these differences, I don't think they show up in the data, albeit limited, that we have. However, the issue has been raised. There is a contention, for example, that a country like Iran was affected dramatically, and there were very dramatic differences between North and South Italy, and there are other cases which someone might wish to relate also to a kind of genetic component. I wouldn't venture on that ground for the moment, but in the future, when we will have better data, we might also deal with that.
Ari, I have a feeling that you may want to respond to that as well.
First of all, I would agree with Sergio. The diversity of, it struck me right away, the fact that you got such a variance between communities, even Orthodox communities or strictly Orthodox communities were very, very different in their ratios. That would dispel any suspicion that there would be a genetic component. But even those who wish to say that there might still be a genetic component, I think have let's say, a simplistic understanding of infection, because the genetic component is only part of a long, long chain of things, many of which Sergio has mentioned, that bring us to the final fact of mortality. You have to be exposed, and where you're exposed is subject to all sorts of chance factors. You have to be susceptible. That susceptibility can be both genetic, but it can also be due to all sorts of circumstances during your life course, which has made you more or less susceptible to infection. And then we build on that to what the healthcare was afterwards, et cetera, et cetera. There's so many factors to take into account in this long chain of events that to focus on genetic factors now would be really, really premature.
Thank you, Ari. That's really really helpful. Look, I'm very conscious we're running out of time, so I think we need to draw it to a close. Apologies for those people whose questions we weren't able to get to. We did have a question early on. I apologise for not addressing this earlier, about whether the slides will be available. We're not going to send them out as a matter of course, but if anybody would like them, then feel free to email us at JPR. The email address is jpr@jpr.org.uk, and we'll happily send you a copy of the slides so you can look at them at your leisure. And of course, the report itself, which contains sort of the commentary around these findings, and it's probably a more useful document ultimately, is freely downloadable at our website, which again is jpr.org.uk. We will be continuing to look at this issue of mortality over the coming months, particularly to try and understand what happened during wave 2. So I very much hope we'll get an opportunity to say more on this topic over time. So look out for that. Look out for emails about that as they come out. But really, from me, just to thank Daniel and Sergio and Ari for your incredible work and your comments this evening. They're very, very helpful. And I just want to close by handing over to the chair of JPR, Stephen Moss, who is the man who stands behind so much of what we do and keeps us on the straight and narrow. So Stephen, over to you for some final words.
Thank you, John. And what an amazingly fascinating talk that's been this evening. And I'm delighted that so many of you have been able to join us from right across the globe, literally. And so thank you first to all of you for sparing the time to be with us. We all know that any talk on mortality is about real people who have died. And so the first thing I want to say is that our thoughts and prayers go out to their families, because this is such a sad time for so many people, and we are certainly not through it yet. But my main task tonight is to wrap up tonight's proceedings. And let me start by thanking both Daniel and Ari for compiling this fascinating and important study. My thanks to Professor Sergio Della Pergola for chairing our European Jewish Demography Unit and for playing an active role on the JPR board as well. And thank you especially to the Rothschild Foundation Hanadim Europe, and particularly to Sally Berkovich and Daniela Griba for having the vision to invest in our European work. And that European work is really starting to be recognized and to have the impact that we enjoy from so many community organizations here in the UK who rely on our research and our studies to make better strategic decisions. Now, as they are increasingly saying in this internet world of ours, there is no such thing as a free Zoom. And as Daniel has already suggested, if you have found this evening's talk interesting, and you've had the chance to hunt around on our website and perhaps to download some of our other reports and had a good look at the amazing range of research that we produce, of which me and the board are so proud, do please consider making a donation and joining the many trusts, foundations, and other individuals who support our work, as we can't continue to do it without everyone's help and support. And it's very easy. You literally click on a donation button on www.jpr.org.uk jpr.org.uk. Now, our next talk is on a fascinating study that Daniel has also been involved in, looking at the Jewish populations right across the globe and the changes in those Jewish populations right across the globe. That's on January the 20th, and we'll be sending out a reminder to all of you about that, but do feel free to register for that, because that too should prove to be an absolutely fascinating evening. And in the meantime, it really only remains for me to wish you a good morning, a good afternoon, a good evening, depending on where you are in the world, and to join you in hoping that the world starts to recover sometime early in 2021. And in the meantime, do please stay well, stay safe, and we hope to see you again soon. Thank you.